and I've been working as a scientist for the last couple of years, but I'm happy to have joined HCS very recently. And I look forward to meeting all the nutrition students. So for the nutrition students, I know you guys have a lot of questions. They will all be answered. You guys just need to meet me on Thursday, I guess. We're going to have our first meeting, but we'll give you an email or a call. Okay, so I'm going to talk to you a little bit about what has been done in the last couple of years in the Nutrition and Healthy Living study that HCS has run. So first of all, we're going to discuss what is nutrition. And basically that studies how your body uses what you eat. This looks at everything from digestion and things like that, and how our body uses vitamins, minerals, everything. So why are we calling this study nutrition and healthy living? And that's because our nutrition and diet affects our body, and there are many diseases that are related to nutrition. Of course, the biggest ones are obesity, diabetes, hypertension, and heart disease. But there are a number of diseases that are related to how we eat and what we put in our bodies every day. And then there are a large amount of related annual health costs due to, directly and indirectly due to these diseases. Okay, so that brings us to the question of what are we supposed to eat? And so the government has some guidelines. The USDA, the United States Department of Agriculture, I'm sure you guys have seen this label on many food items, and the FDA are responsible for determining kind of some general guidelines of what we're going to eat. They put out things like the food pyramid. This just tells us the number of servings of different types of foods or categories of foods that we should be eating every day. And I don't know how many of you guys have looked at this, but you should. And they're involved in a lot of nutrition and health initiatives because they're worried about these nutrition-related diseases. So if you noticed recently at a lot of restaurants in New York City, they have calorie listings like posted on the menu that's up there. So now when we go to McDonald's, we know that, your Big Mac has, 600 calories or whatever. It also happens with food labels. Everybody is basically, or manufacturers are basically required to list fat, protein, and carbohydrate, and vitamins and minerals. So there's something called the Dietary Guidelines for Americans. This is a guide that's made every 5 years as a general recommendation for nutritional intake. It's made by the government as well as people from the private sector. There's a number of foundations that are involved in this, and their goal is to promote health and to reduce the risk of chronic diseases associated with diet. Within these dietary guidelines, it says that you should be eating 3 to 5 servings of vegetables and 2 to 4 servings of fruit every single day. And the aim of that is to increase the number of Americans that consume more than 2 servings of fruit a day, and also the percentage of Americans to consume 3 or more servings of vegetables per day. And this combined 5 servings of fruits and vegetables are targeted to promote healthy living. So what are the effects of consumption of fruits and vegetables? Now there's a number of groups in the literature, and all of you guys are at some point going to learn how to do literature searches, that show that food group consumption is based on educational factors, socioeconomic factors, demographic variables, and also cultural and psychosocial factors. And that basically relates to what we're going to eat. So in our studies, we're going to try and look at some of these parameters. We're going to look at accessibility, which is basically a measure of the cost and whether or not families can find it affordable to buy the produce. Availability, and that is simply what it is, whether or not it's available in the community or in the area, whether or not there is fresh fruit and vegetable there. And then, of course, all of you, when you go into the grocery store, you look at the appearance or the quality of the vegetable, the size, the ripeness, whether or not it's bruised or not. Okay. So one of the health initiatives that the government has, or that New York City has tried to do, is the Green Market Program and the youth markets are all run by the same people. It was founded a while ago to promote regional agriculture by providing small family farms the opportunity to sell their produce and to ensure that all New Yorkers have access to fresh, nutritious, locally grown produce. And this is because in urban areas we don't necessarily get the best produce. Okay. So in past years, what they did was assess the quality and price of the produce in various neighborhoods in Manhattan and the surrounding boroughs. Green markets were compared to nearby grocery stores and bodegas. And the aim of the study was to correlate differences in price, quality, and availability with the neighborhood, demographic, socioeconomic status, and rates of nutrition-related diseases. I'm just going to show you a few of the results. So from the 2008 studies, these are all graphs for quality parameters. So we have color, freshness, size, and appearance. So that's color, freshness, size, and appearance. And by showing it in this graph form, you can see very easily that in every single quality parameter, Washington Heights has the lowest scoring produce. Okay. So basically, I'm just going to summarize that. The worst quality produce was found in Washington Heights. This is predominantly a Hispanic neighborhood, which we mapped with GIS. And it has a low percentage of residents that have a high school or college education. What we also found with the cost analysis is that in 3 out of the 4 neighborhoods visited, the price of produce was lower at the farmers market. And in the one neighborhood where the price of produce was higher at the farmers market, most of the quality assessments were also higher. In 2009, we had about 80 students in the program. They did something very similar. They assessed farmers markets, supermarkets, and corner stores all within certain neighborhoods. And in 2009, what they found was that the farmers market have smaller but better quality produce than grocery stores and bodegas. Okay, and so based on this, all of this data from 2008 and 2009, it looks like farmers markets can provide higher quality produce at lower costs to urban areas, and this is likely due to the decreased cost of produce transportation and the overhead costs that are associated with bigger stores. Okay, so the students who are in the 2010 nutrition study, you guys should be writing this down and paying attention, and everybody else should be too, but this is what you guys are going to do this year. First and foremost, you're again going to assess the quality, cost, and size of produce at farmers markets. This year we're going to include the youth markets, which are youth-run farmers markets throughout the city. And we're also going to look at all the grocery stores and bodegas within like a 3 or 4 block radius of the farmers market. We're going to assess whether or not grocery stores and bodegas have healthy alternatives, and what the government has looked at in the past is things like low-fat dairy products, organic produce, and antibiotic-free chicken. We're also going to find out whether there are healthy living programs or initiatives in the area. And then we're going to correlate these parameters back to the demographics and socioeconomic status of the neighborhoods that we visit. The second part of the study, we're going to learn what contributes to diet, nutrition, and healthy living with respect to nutrition-related diseases. And this is where I'm going to expect that all of you learn how to use PubMed and also learn how to read science papers. Then we're going to work on a survey to give out to the other students and family members, so your own family members and other family members of the other students. And we're going to learn about nutrition and healthy living in relation to your communities and what diseases affect your communities most greatly. The third part of this, as we end this program, we're going to try and identify a teacher or staff member at your school so that this becomes a year-long study. We're going to look at the ways that you can bring a nutrition education program to your school. And this could be through a club or an organization, or simply by suggesting things for school lunch, or more formally in class. And I'd like to thank all the students who have participated in the past years in gathering data, and I look forward to meeting all of you in Fishman.